Hello, friends. I hope you're having a great day today, and we are now about to migrate into the next case. And we will call this fine young gentleman whom I saw at least 40 years back in 1980 or thereabouts. He was 21 years old. I remember that. But this particular case is locked into my hard disk. Now, this case stands out. No case is outstanding. So I'm just trying to play on the words. They stand out. They are not outstanding. They are not interesting because the patient is vulnerable. So basically, these are profound perceptions over the long journey that I've had of 48 years. So this gentleman, 21 years old, the situation is an outpatient department in a very, very busy hospital. It's a municipal hospital. It is a free hospital run by the government, and lots and lots of patients, but lots and lots of experiences as well. So this was an outpatient clinic, and I had already done a very grueling session in the morning. I was a senior resident at that time. We were called registrars at that time. And this patient comes in with his father, a slightly burly looking gentleman, and the patient, a very lean person. So the contrast first, you know, I remember it. Interesting second perception was that I was about to say goodbye to the clinic because it was afternoon time around 1:30. It finished all the patients, and this gentleman with his father strolls in. And what was really interesting is that he had a bag in his hand, a cane basket to be exact, with a lot of grocery items, and actually they were not even covered. I could see vegetables, fruits, etc. So it looked like as if the patient had come in for a stroll to the clinic, and it was a by the by experience. He says, "Could you please see my son?" And by that time, I'm sorry to say, but I was literally feeling hypoglycemic. I think my blood sugar must have been at the ebb because I had had a very scant breakfast too. So I said, "I'm sorry, the clinic is closed. You'll have to come tomorrow." He says, "Just a very routine checkup, doctor. His mother is, worried about him." I said, "Well, the clinic is closed now. You can come tomorrow. This is a routine checkup. You can wait till for another 24 hours." So he, so I start to wind up my subject matter for the day, and this gentleman comes back after maybe 10 minutes with a little note, small note from the dean, "Please see." It got me pretty furious. Frankly, I was almost wild. I'm sorry to say that, but it was true. And well, I had no option. I was relatively very junior, and so I said, "Okay, it's a routine case, so let's try to wind up very fast." So as he was sitting down, he was wearing a long sleeve shirt. The boy, 21-year-old, and as I started taking down his history, what is the problem? I said, "The problem is that his mother feels he's getting weak." I asked him, "What do you think? What is happening to you?" He says, "No, I'm all right, but I just feel sometimes a little dizzy." So, with this little formal introduction, I notice on his on his wrist a little dyspigmented patch, which looked the color of when you add coffee with milk, and that is called in French, and the term is translated really cafe au lait. Cafe is coffee, au lait is with milk. When you add coffee with milk, this is the color exactly. Now, it did sort of little bit excite me to ask for more until I asked him to reveal his arm, forearm, etc. And I saw more like these. Now, I had read about this kind of thing because I was doing my internal medicine MD, and I had read about this about 3 or 4 weeks back. So, and I was about to appear for an exam, basically the MD exam. So I was tempted to ask him to remove his shirt. So when I asked him to remove his shirt, I noticed right behind he had a whole treasury of these cafe au lait spots. Now I had literally taken off his shirt and now made him sit down. And then I started to feel, I noticed a lot of neurofibromas. Neurofibromas are little swellings which are actually on the nerve sheaths, on the sheath of the nerve. The sheath of the nerve is the covering of the nerve. Let me move on before you get a little bored. So I then examined everything, all the systems, respiratory, cardiovascular, because these kind of cafe au lait spots and neurofibromas are sometimes associated with systemic ramifications, consequences. I could find nothing. So I then went on to neurology and I did all the cranial nerves and motor system, sensory system, coordination, balance, everything I thought was complete, including reflexes. I could find nothing. There was still one more test that I needed to do to complete the neurological workup, and that was the fundus examination, the ophthalmoscopic examination. You can make out from my pause that was exactly what happened to me when I saw his fundoscopic examination. He had an absolutely grade 4 papilledema, choked discs in his eyes. Now, for my viewers, this is a very ominous situation and it spells out something which is not right in the brain. The internal pressure in the brain is markedly enhanced, is increased, and yet now on re-inquiring, no headaches, inconspicuous nondescript dizziness, and no other neurological manifestation. Vision is fine, everything is good, neurology was intact. So how do I break this news to the parent who's come walking in, strolling in? I refused to see him in the first place, and now I have to tell him that, look, your son needs to be admitted to the hospital. His reaction was very, very commensurate with what I expected. He says, you were not willing to see him and now you want to admit him to the hospital. Very correctly put. I mean, patient's father was right. Then I explained to him what I saw and what I examined and what we need to examine further with regard to the brain. But before I wanted to admit him, I wanted to have one more actual opinion as to what I'm seeing in the fundus is really what is correct. So in spite of the fact that I told him that he needs to be admitted, at 2 o'clock, around about maybe half an hour or 15 minutes later, there was a neurology clinic which was also starting. So I asked the assistant professor over there, or he was, I think, a senior tutor. I said, can you just have a look at this with the fundoscope? And he says, yes, this is severe grade 4 papilledema. He knew he needs to be immediately admitted to the hospital. If you want, I can admit him under my care. So in any case, he was admitted in internal medicine care for further workup. And next day, we ordered a CT scan. But next day was too far, so we also got a neurosurgical consult at the same time. And the neurosurgeon, very senior, head of the department, was ushered in, and he sort of examined him threadbare. And he was also very surprised that this is asymptomatic or relatively asymptomatic without symptoms. And this is the problem. So he kept on asking him, no headache, no this, no that. Everything was quite negative. And his neurological workup was the same as what I had also calculated. Okay, so next day CT scan comes and he has a tumor in the right frontal lobe, fairly reasonable sized tumor, more than a lemon. And I still ask myself that despite that, why did I not even do? I thought I'd done his entire examination and his cranial nerves are all intact. But having known that this is a right frontal tumor, how is it that I didn't examine the olfactory nerve, the nerve that is the sense of smell? That I think was a failing. We talk about feelings, we also have to talk about failings. But later on, I did ask him that, do you have a good sense of smell? He says, doctor, in fact, I think I have a very good sense of smell. My sense of smell when agarbatti or something like incense comes into play, my sense of smell is so powerful that I feel too much sense of smell. Now, retrospectively, I feel that that tumor was irritating the olfactory nerve and causing a hyperosmia for him to smell more than what a normal person would feel. Good indicator here, and good for medical students also, the interested ones, to know that when we examine the cranial nerves, we often take the olfactory nerve for granted. I can't speak for all, but I did take it for granted. So this patient was finally operated, and the biopsy result was very ominous. It was a neurofibrosarcoma of the brain. Very unusual. I'll repeat, neurofibrosarcoma, and you can research it out. It's quite unusual, of the brain, and can be associated with this neurofibromatosis, this, cafe au lait spots and those little small bulging growths on the nerve sheets, as I mentioned earlier. Patient was operated, and for some reason, post-operatively, he developed facial paralysis on the same side of the surgery. Anyway, that could have been the consequence of the surgery itself. And you can imagine how the patient's parents must have reacted to this. I mean, this was just absolutely catastrophic, that their son, who was absolutely completely all right, followed his mother's intuition, comes in for a stroll, and finally we land up with a diagnosis of this kind. So I presented this case to the clinical meeting, and clinical meetings are very, very intimidating because the entire faculty is there and they're actually peering down like the vein in your neck, and literally breathing down your neck, all of them waiting to ask questions. And at the end of that meeting, in that particular case, they were just not willing to accept that, this child, this patient, N1, was with such inconspicuous or no symptoms and no examination findings as such. So I had actually called his father out, made him sit on the bench outside, and I told him that in case you are required to, say a few words as to how you presented yourself, then go ahead and speak your mind. And since they were all not willing to accept it, I had to use this option, And I called in the patient, and he said, and he verified that this was the situation, that he came in, etc., the way he did. And really, boy had no symptoms as such to warrant such a consequence. And then we had the pathologist also opine and everything. It was like a foolproof diagnosis. And finally, well, they had to believe the story, and they did feel at the end of it that the scar on his head was because he was examined. But they didn't know that, well, I had almost refused the examination, refused to examine him. But anyway, so so is it, what is the moral of the story? Is it that every patient needs a general checkup? Is it that even inconspicuous symptoms need to be examined? Is it that an annual checkup needs to be done even for the youngsters? I mean, all of this depends once again on your doctor, on your physician, who is going to be the best judge of it. Whether this needs to be done semi annually, annually, biannually, I think this is something which your physician only can decide. And I would ask you that if you have any kind of symptoms, speak it out with your doctor. This is, I think, point number one. Point number two is neurological examination should mean that when you say cranial nerves are all normal, the patient is okay in time, space, self, and person. I mean, these are kind of almost platitudinous when we sort of, you know, um, uh, uh, go into a kind of a mode of articulation. But we sometimes forget that the cranial nerve one, that's the olfactory nerve, is also important. In this case, the hyperosmia could have led someone to believe that, well, there is something wrong, and you could possibly even think that something is irritating the olfactory nerve. But in any case, the CT scan confirmed it, but you could have got that clinical evidence even before the CT scan that something is there close to the olfactory bulb. This is for the interested medical student. And of course, post surgery, the complication can be anything. And finally, I have to report that this neurofibrosarcoma of the brain, which was associated with neurofibromatosis, which is also called von Reckling-Oschen's disease. Big word, I don't need you to memorize this. It's good for the medical student to know. I mean, he already knows it. This patient could not make it at the end, obviously. I mean, it was a malignant tumor. But just to think that how this whole thing progressed so rapidly, in 6 months' time, it was all done. It is sad to see that a person comes walking, talking to your clinic, is identified with this kind of problem, goes through this kind of surgery, has this diagnosis and this end. Well, there's nothing more that I can say or do except to feel. I still remember him after 40 years. Obviously, it has impregnated itself in my mind. Thank you very much for being patient with me and listening to this conversation. And I look forward to having you over with me again in the next case. Thank you. Goodbye.